Today, we're going to pull back the curtain on some of the most significant Medicare changes we've seen in years, all set to hit in 2026. And these are not small adjustments, they're fundamental shifts that will impact your budget and your healthcare. It is absolutely crucial that you watch this video all the way through because every single detail we're about to cover is a piece of a larger puzzle, and you don't want to be left with a missing piece when it comes to your financial security. Now, before we dive into the hard numbers, I want to tell you a quick story that's going to set the tone for this entire video because it perfectly illustrates what's at stake. I had a potential client call me, we'll just say her name is Susan. Susan had her retirement all planned out down to the penny. She had her budget in a spreadsheet. She knew exactly what her Social Security check would be, and she was ready to finally relax after decades of hard work. But what Susan didn't know, and what too many people are unaware of, was that the government was quietly getting ready to make some adjustments that would completely blindside her plan. I mean, we're literally talking about the largest projected jump in your Part B premium in the past decade, and it's set to hit her budget and yours like a ton of bricks. Now, we definitely don't want you to be Susan. You have worked too hard for too long to be caught by surprise, and you can completely avoid that financial shock as long as you're not caught off guard. So let's get right into the numbers. Why 2026 is such a big deal? Okay, here's the deal. Before we get into specific figures, you've got to understand why 2026 is shaping up to be such a pivotal, transformative year for Medicare people. These changes aren't just happening out of nowhere. They're a direct result from the Inflation Reduction Act being passed, or the IRA. Now, the IRA brought some amazing things to the table, and we have to acknowledge that. It's allowing Medicare to negotiate drug prices for the first time in history, and it capped insulin costs at $35 a month for beneficiaries. Those are historic wins for every single senior on insulin and on medications on Medicare. And this is the part that gets lost in the headlines. That law also completely changed how the whole Medicare Part D prescription drug program is funded. It shifted some of the cost burden away from the government and onto the insurance companies and manufacturers. At the very same time, the cost of healthcare itself is just getting more and more expensive. Think about it this way. A procedure that used to require a long, expensive hospital stay, which was covered under Medicare Part A, is now frequently done in an outpatient center. And when that happens, all those costs shift right over to Medicare Part B. It's the same procedure, but a different part of Medicare is footing the bill. Now, under federal law, Medicare beneficiaries have to cover about 25% of the total cost of the Part B program with their premiums. The other 75% is paid for by the general tax revenue. So when the program's total costs go up, either from inflation or from more services being shifted to outpatient settings, you can bet our premiums are going to follow as well and trend upwards. And it's just created a perfect storm. This isn't just a small, predictable cost of living tweak. We're looking at a major structural change that could catch a lot of folks on a fixed income completely off guard. And that preparation starts with the most important number of all, your monthly Part B premium. All right, let's just address the elephant in the room. This is the number that's going to affect pretty much every single person on Medicare, whether you have original Medicare or a Medicare Advantage plan. If we look at the official Medicare Trustees report, the standard Part B premium is projected to jump from $185 a month, which is what it is now in 2025, to a staggering $206.50 a month in 2026. Now, I know that's not official, but let that sink in for a moment. That is an increase of $21.50 every single month. And this isn't just an analysis's guess, this comes directly from the government's own actuaries. And while the final official number won't be announced until the fall of 2025, these projections are historically very accurate. And at the time of recording this, they are our best roadmap to go off of for 2026. Now, a $21.50 monthly increase may not sound like a lot on its own, but let's break down what this actually means for your wallet. For one person, that's an extra $258 a year. What could you do with the extra $258? For many, that's a month's worth of groceries. That's a car payment. For a married couple on Medicare, you have to double that number. That's an extra $516 per year that you didn't have to pay before. That could be a plane ticket to visit one of your grandkids. That's a huge chunk of the utility bill. It's a big deal no matter what your fixed budget is that you live off of in retirement. And the most painful part is how this increase directly impacts your Social Security check. The Social Security Cost of Living Adjustment, or COLA, is projected to be around a modest 2.5% for 2026. Now let's do the math. On an average Social Security check of $2,000, a 2.5% raise on $2,000 is an extra $50 a month. That sounds nice, right? But when you immediately subtract the $2,150 premium increase, which comes out automatically from your check, you can see that almost half your raise is gone before you even see it. After that's subtracted, your net gain is only $28.50. It's a classic frustrating case of one step forward and half a step back. Now, while the premium gets all the headlines, there's another critical cost that's set to rise alongside it. I call it the sneaky deductible creep because it's a cost that you don't think about on a monthly basis, but it hits you the first time you need to use your healthcare benefits for that year. This is the Part B deductible, the amount that you pay out of pocket for doctor visits and other outpatient services before Medicare starts paying its 80% share. Now for 2025, that Part B deductible was $257. The official 2026 number isn't out yet, but it almost always goes up when the premium does. Based on the current trends and projections from the trustees report, we can expect it to land somewhere between $270 up to $280. This is the cost that you don't think about until you actually have to go to the doctor for an illness or get some lab tests done or you need an MRI. And this is super crucial for anyone with a Medicare Supplement or a Medigap plan. Because if you have a Plan G or a Plan N, which are the most common plans for new Medicare beneficiaries, you have to pay this deductible yourself out of your own pocket before your Medicare Supplement kicks in. So for the hundreds of thousands of you that are on those type of plans, this increase is a direct dollar for dollar out-of-pocket cost that you're going to feel. When you add a higher monthly premium to a higher annual deductible, the total price just to use your Medicare benefits is going up and way up. Okay, so now that we talked about the rising costs for medical services, let's shift gears to prescription drugs and Part D. This is one area where the Inflation Reduction Act brought some genuinely fantastic news. In 2025, for the first time ever, there's a hard cap on your out-of-pocket drug cost of $2,000. This is a true financial lifesaver for millions of Americans who take expensive medications. It's also one of the best things to happen to Medicare in a long time. However, and this is a critical detail that you need to be aware of, that cap is not fixed at $2,000 forever. It's designed to be indexed, meaning it will go up with overall program costs to keep the program solvent. For 2026, that annual out-of-pocket cost is projected to increase from $2,000 a year to $2,100 a year. So on one hand, having a cap at all is still a massive improvement and provides incredible peace of mind. But on the other hand, your maximum potential cost is going up by $100. At the same time, the standard or base Part D deductible is also projected to increase to $615 in 2026, up from $590, which is what it was in 2025. So you've got a slightly higher deductible on the front end before your plan starts paying, and a slightly higher maximum cost on the back end. It makes doing your homework and picking the right Part D plan more important than ever. Now we've covered the cost that affects everyone, but now we need to talk about IRMAA, which stands for Income Related Monthly Adjustment Amount. This is the extra charge that higher income folks pay for Part B and Part D of Medicare. And this is the one that catches so many people by surprise during retirement, just like our friend Bob from the other video. Now here's the deal, and this is super crucial to pay attention to. Medicare will always look back 2 years when determining how much you pay for Medicare Part B and D of Medicare. Now let me repeat that because it's so important. Your 2026 premium are based off of the income you reported on your 2024 tax return. I can't reiterate that enough. This catches so many people off guard. They retire in 2025, their income drops significantly, but Medicare is still looking at what they were making back when they were working full-time in 2024. Let's look at this chart here. For 2026, if you're an individual and your 2024 modified adjusted gross income was $109,000 or less, you'll pay that standard $206.50 a month premium that we talked about earlier. If you're married filing jointly, that threshold is $218,000. But if your income is even one single dollar over those thresholds, you get bumped up into the next tier and get hit with a significant surcharge for the entire year. The more money you made 2 years prior, the more you're going to have to pay. The key thing to know is that there's a solution if your income has gone down. If you had a life-changing event that's lowered your income since 2024, like you stopped working or you retired, you can and absolutely should appeal this. You file a form SSA-44 with Social Security's administration. Other qualifying events include marriage, divorce, or the death of a spouse. This is a critical piece of information that can save you hundreds or even thousands of dollars a year, but you have to be proactive and file that appeal because Social Security will not do it for you. Okay, now that we've gone through a ton of stressful information and it can certainly feel overwhelming, this is the important part of the video. Being prepared is your best defense. Knowledge is power, and knowing these numbers ahead of the time prevents you from being blindsided. The single most important step that you can take is to commit to doing a full, comprehensive review of your coverage during the next annual enrollment period. If you have a Medigap plan, you are directly exposed to that projected $206.50 Part B premium and the higher Part B deductible. So your main job is to budget for now and to aggressively shop your Part D plan to make sure it's still the most cost-effective one for these specific medications that you're taking. If you have a Medicare Advantage plan, you still have to pay that same Part B premium directly to Medicare. You're not immune to that cost, but the good news is that the government is increasing its payments to these private insurance plans by about 5.06% for 2026. So they will likely continue to offer robust benefits for your plan. But your job during open enrollment is to look beyond the lure of a $0 premium plan. You must analyze the plan's maximum out-of-pocket or MOOP and the individual copays for specialists, hospital stays, and lab work to see where your total financial risk really is. Because a $0 premium does not tell the whole story. Now let's recap. We're looking at a projected Part B premium of $206.50 a month. We're looking at a higher Part B deductible creeping towards $280. We have a rising Part D drug cap of $2,100, and we have the IRMAA 2-year look back that could be a major financial shock if you're not ready for it. These are not small tweaks. There are a reason to sit down and make a concrete plan. It's looking like the rules of the game are changing or are going to change for 2026, but you don't have to play it alone. Now, I know retiring and navigating Medicare can be stressful, but I wanted to let you know we have 2 links down below in the description of this video to help you. The first one is where you can get our 2025 Medicare Planning Guide at no cost. We're giving it away completely for free, so please utilize that link down below. It summarizes these changes and gives you a checklist to follow. And the second link is where you can book a free one-on-one consultation where I or a member of my team will personally reach out to you, or you can simply call the number on the screen right now. On this call, we will answer any retirement questions that you have, any Medicare questions that you have, and we'll go over the specific plans in your area to see how they'll cover your specific medications, your doctors, and your pharmacies. And all of these services are 100% free of charge. And we can even help you enroll if you find a plan that's a better fit. So please take advantage of the links down below or call the number on the screen. And don't forget to like this video, comment with your questions, and subscribe to our channel. Be sure to click that notification bell because we'll be providing immediate updates as soon as the official 2026 numbers are released in the fall of 2025. Now, thank you so much for watching. Go watch this video where we discuss the #1 Medicare plan in all of America this year. I'll see you over there.